Hello there, fearfully and wonderfully made human. Welcome to another episode of the Holistic Counselor Podcast, where I try my best to honor God, the God that heals, the brain that He designed, and the whole person He created you to be. I'm your host, Diana S. Rice, licensed mental health counselor and certified integrative mental health professional. And today we're stepping into a conversation that so many people in our communities have been quietly searching for. Recently, I attended Dr. Kate Johnson's domestic violence presentation, and afterward, I met today's guest, someone whose calm, grounded presence instantly stood out. We started talking, and when she told me she specialized in TMS, I felt that familiar nudge from both the clinician in me and the Holy Spirit. This is something people need to understand. Because let's be honest, there are moments in our healing when prayer, community, and therapy are vital, but sometimes they're not the full picture. Sometimes the brain needs additional support, and that doesn't make you weak. It makes you human. So today, I'm honored to welcome Jacqueline Simon, MS, RN, PMHNP-BC, a psychiatric mental health nurse practitioner who has served individuals and families across hospitals, the VA, and major treatment centers. What I appreciate most is that she sees mental health the way I do, and she approaches each person with compassion, curiosity, and evidence based care. My hope is that this conversation brings clarity and removes shame. If your brain needs support, that does not mean your faith is weak. It means your nervous system has been carrying more than it was ever designed to carry alone. And before we begin, I just want to gently ask if this podcast has been a blessing to you. It would truly mean so much if you leave a review, like the video on YouTube, or visit the merch store to support the mission. Not for me, but because every bit of encouragement and engagement helps this message reach someone who feels stuck, discouraged, or ashamed to ask for help. We are building a community where mental health, faith, and truth can coexist without stigma. All right, so let's step into this conversation. Jackie or Jacqueline, thank you for being on the show. Wait, can I call you Jackie?
Yes, yes.
Okay.
You don't have to call me Jackie. And thank you. Absolutely. I'm happy to be here.
All right. So I know we talked about you went to one of the local private schools that I used to sub at and stuff, and I was so excited about that. I was like, "Oh, how cool is this?" But anyway,
Yeah.
what inspired you to move from nursing, right, into
Mhm.
psychiatry, and what moment made you realize this was your calling?
Let's see. So I've always, had an interest in science, had an interest in, behavior and how people interact with one another. And then when I was when I went to college, I took a psychology class and I just thought it was very interesting. And, you know, I wasn't, conscious at the time, but it kind of never left that was something I really wanted to do. And then, I come from a family of medical providers. It was kind of, in the blood, I guess you could say.
Yeah.
And I went to nursing school, which was great. I've always, been passionate about helping people um, and then again, I got to do a clinical at a psychiatric hospital while I was in nursing school. And I just thought, this is fascinating. This is amazing. And I wanted to learn more about it. And there's been like multiple different forks in the road along the way, I guess you could say, that have just
Yeah.
kind of led me to where I am now. So it's
Yeah.
natural
I mean,
progression. Absolutely.
that's something that I realized too. I really didn't. My youngest son right now is at UVA and he's doing his psych rotation as a nurse. And he's just like, wow,
Awesome.
mom, now I understand. Like, like you can't talk about like everything, but it's just like, okay, now he sees like, wow, that's really interesting. Like,
Yeah.
so what was it that interested you the most? Like, just like behavior or like, wow, because I know why I decided,
Yeah.
it was a calling and honestly, for me, it was more of like, why did the people in my family behave this way?
Well, that's always part of it, a little bit, right? For a lot of
And me
people,
too.
yeah.
Right. And me too, though. Like
Yeah.
I was feeling certain ways and I was trying to understand myself as well, which I think a lot of people
Right.
that go into our field and into this field, everyone has a story. So to me, it's just like, yeah, like the psychiatric mental health nurse practitioner. What is the difference in what, like, people think nurse or automatically they want to probably call you Dr. Simon because sometimes they call me Dr. Rice. I'm like, oh no, no, no. I'm in a master's degree. I did not go to med school. So can you just describe a little and what's the difference from like a psychiatrist or a therapist?
Sure, absolutely. So I'm an advanced degree nurse. So I became a nurse. I became an RN, a registered nurse, after graduating from nursing school. And then, I worked in the field for a little bit and decided I wanted to continue to pursue the psychiatric care component of nursing. So I went back to school and got a master's degree, Bachelor of Science, in nursing, specifically in mental health nursing.
Hmm.
And then typically you'll pass, a national certification exam, and then you'll become board certified and become a psychiatric mental health nurse practitioner. And that, this job allows me to, I can provide therapy, which is great. Typically, most of the people who are psych NPs do primarily medication management, and we usually work alongside, a psychiatrist
Okay.
or other, medical providers in, um, you can find us in inpatient hospital settings, a lot of outpatient clinics also.
Okay.
Different than a therapist, I'd say probably our training doesn't focus as much on providing therapy as it does on medicine and, biology and anatomy and things like that. And then different from a psychiatrist or a medical doctor, it's not as long of a education program typically for most of us,
Right.
although there are some nurse practitioners that do a doctorate level program and are doctors.
Oh,
Yeah,
but it's still different than a MD?
it's still different than an MD.
Okay.
Yep. It's not
Okay.
medical school.
Right. Well, or residency. Like, did you have to do a residency?
No, I didn't do a residency. I did what they called it,
Like a practicum or internship?
kind of, yeah. It wasn't
Yeah.
an internship, but it was before I graduated, and it was just, I spent a lot of clinical hours in one facility with a
Yeah.
preceptor.
Right. Okay.
Yeah, really
So it's
getting.
kind of like I did a year practicum, it was called,
Oh, okay.
hands-on. So I'm thinking it's the same, but different because yours is geared towards understanding like the science of probably the brain more than I did. Mine was more like, did you learn like CBT or other modalities in therapeutic, or was it more just focused on here's the medication and this is what it will help, or how was that?
It was mostly geared towards medication, I'd say, and
Mm.
kind of underlying biological components of mental illness. But we did get a little taste of different therapeutic interventions,
Ah,
which was
okay.
great because then as I, got more into the field and have gotten to work with therapists over the years and had the opportunity to continue my education, like where we met,
Yeah.
I kind of had a base to start from.
Yeah, I loved that. I loved seeing you there because to me, that's where I was like, oh, I want to have a conversation. Because for me, for any psychiatric anybody that comes in that wants to learn other things or holistic things, to me, I'm like, okay, good. They're open-minded and they're not just in the conventional insurance mindset that many of us are trained in, and
Yeah.
honestly, I rather go to a nurse practitioner of whatever, like specialty I would go to, just because they seem to have a little more time and just more. It's not like not saying all doctors are like this, but like the rush 10-minute, 15-minute, let's go, move on. But a nurse practitioner, it's like that's, because I remember people like, I don't want to go to the nurse practitioner. I'd rather go to the doctor. They're the ones that are trained. And I'm like, yeah, there's a shift in the culture of understanding. Like, no, they're trained and now they're newer, coming in with a newer training as well, and has the patience of being able to, you know, be with, I think that's the biggest thing I hear now that I have clients that come out of certain, community health, or conventional. And what I mean by conventional, I know that we have, people have to go. They have to go and get the help they need. And I totally understand
Right.
that. It's just understanding too that, like, to take the time to really get in tune with yourself of what you need, because sometimes what happens, we trust so many professionals out there and now we've lost all agency.
Right. Yeah, it can, and part of the reason I started my private practice about a year and a half ago now is because I really kind of wanted to be able to take that extra time and to, explore more so like oh, the client presents this problem to me and they, want assistance and need assistance. What are they okay with trying? What have they tried? And what do they feel comfortable doing? And then I try to, use all the different resources and information that I've learned to really come up with something that they feel good about. I feel like, will be good for them and safe for them. And yeah, it's really kind of tailored to their needs.
Yeah.
And the more I learn about, different domestic violence or different types of therapies, the better understanding I have when I meet with people.
Okay. So talking about different kinds of therapies, because this is what is intriguing. I have not spoke to anyone yet that will hopefully teach me, educate me, learn me, as I would used to say back when I worked in alternative high schools. Uh, um, TMS. All right.
Yeah.
Let's discuss this because I know I think it's magnets. I should know a little more, but I never went down that rabbit hole completely because I don't I can't use it. I'm not a practitioner of
Right,
it or
right.
anything like that, but I want people to understand what that is, like all of it, the good, the bad, and the ugly. So
Sure.
tell me, can you explain it in real simple terms? Just pretend you're talking to a ninth grader, because sometimes that's why I would have to read things over and over. But
Okay. Yeah.
what is TMS? T as in Tom, M as in Mary, S as in Sam.
So TMS is transcranial magnetic stimulation, and it is indeed a magnet. So it's a high-powered magnet, and when you see the machine, there's a machine and then a chair, and then they have a paddle that has the magnet in it,
Okay.
and they'll place it against your scalp. And then, depending on, I guess, well, the first step would be you do a psychiatric evaluation to determine, like, okay, what are we going to try to treat potentially with TMS? And TMS was actually, I believe, originally FDA approved in 2008. So it's actually been, and being
Okay.
used prior to, but FDA approved in 2008. And I feel like just more recently has it been more available to people. And a big reason for that is the cost. It can be expensive and insurance companies are covering it now. Mostly I see for depression,
Hmm.
which is really wonderful. But I think getting it covered can sometimes be an issue. They typically want you to have, tried a couple of different medications for depression before, they'll approve your treatment. But I'm hoping that that's changing. Um, and so it's FDA approved for depression. Now, anxiety associated with depression,
Okay.
OCD, smoking cessation, and there's a couple other indications that aren't, mental health related necessarily.
Right.
But it can be used in other things. I've seen it be used for other addictions. Yeah.
I was wondering, it's not electro whatever the stuff that back in the,
It's not
1900s.
ECT.
Okay, because let me tell you,
Yeah.
like that stuff, and I've seen some side effect people that have gone through this, and I'm like, it breaks my heart. Like I'm like, and then it's not a lobotomy either. So,
No, right.
well, it's just you got
It's
some scary,
invasive.
yeah, you got some scary stuff out there. So I just want to know more about like,
Sure.
when you're messing with the brain, because many of us don't, we're still learning about the brain. Like there's just, it's amazing. This is just like I don't want to say the wild, wild west, but our brains are just spectacular
I know,
organ.
it's amazing, right? Yeah.
Yeah. So tell me more about like the results that you've seen with TMS, especially for people that have not responded to traditional medication. Do you do medicine and that, or do they have to like um, be de-prescribed the medication first and tapered off and then use it? Like, tell me a little more of how that works.
So you can be on psychiatric medications while
Hmm.
you do TMS. You also don't you that's not necessary. You don't have to be taking a psychiatric medication to do TMS, right? Um, If you are taking psychiatric medication, it's recommended that you don't make any major changes while you're doing your TMS protocol, just because, it's another factor kind of thrown in there. But you can absolutely take medication while you're on TMS. Some medications may affect your sensitivity to the stimulation, but you'll
Hmm.
still have a response. You might just require a higher or lower dose, if you will, of the stimulation.
So, okay, do you have to shave your head?
You don't have to shave your head.
Okay.
So they take that magnetic coil, right? And
Okay.
and they'll find your motor threshold. That'll be your first appointment. So you'll come in, they'll do some measurements on your scalp, and then they'll determine what amplitude or strength of the stimulation you need to
Wow.
cause your brain to respond. And once they kind of are able to calculate that dose, then the next time you come in, or if you end up doing it that day, they'll use a percentage of that number that they've calculated to administer whatever protocol it is. And they have different protocols that they'll use for depression or anxiety or, trauma, OCD, and also different brain areas that they'll target with the magnetic stimulation.
So do they do a brain scan first? Is that what you said? That they would, do they put like, tell me, like, do they put 100 little things, or is it a cap, or is it just one big magnet and someone's just holding it
So
there?
different, so different TMS devices and
Okay.
software will use different methods to kind of determine where they're gonna target the stimulation. So
Mhm.
sometimes they'll use a cap. Sometimes they'll use software that, they'll place sensors on your head just superficially,
Okay.
and it will communicate with a sensing device that will communicate with the software, and it'll kind of give a generalized area to target based on multiple, what we consider normal patient scalps, right? Or giving us
Normal.
a pretty good idea. Maybe not
E-
normal, but
Every time I hear the word normal, I'm like, gosh, I've been on this earth for 54 years and I'm still trying to figure out what that is.
right, right. Yeah, just I guess a better word would be
Yeah.
kind of, or
Yeah.
a better way to think about it is based on all these different images that we've been able to collect,
Okay.
we can use all of that information to kind of standardize based on what your brain and scalp are shaped like to determine where we're going to focus.
So with the psychiatric evaluation, right? You sitting there and you have to figure out weight, right? Like is that how you age, weight? I mean, how thorough
Yeah,
is a
yeah,
psychiatric evaluation? I mean, I know you probably do a biopsychosocial, but to find out, I'm just think here goes my brain, like how I
right,
think
right.
I probably need TMS to calm me down. Uh, but I'm just wondering how. You walk into say we're doing because it could be scary. I could imagine like being,
Yeah.
doing anything first time in this field is sometimes, especially when you're messing with the brain or taking a substance or something like that. Like sometimes, I hear about ketamine or, because
Right.
everything we do, even supplements, can have a side effect, right? If you take too much magnesium, you can get diarrhea. Like it's just
Right.
things like that. So I just want to know, honestly, like you walk in, say with you to your office, because it's going to be different with you than the next psychiatric nurse. And this is what makes you so unique, right? Um, it's just, do you spend like 30 minutes with them? Is it a thorough, like, hey, because I'm still trying to figure out how this works. I know we're electrical beings. I get it, like EKGs and stuff for the heart and stuff. But people that don't really understand this, they're going in and it's like, what is this, like witchcraft? Like, how do you
Yeah.
explain it with evidence, science, along with just normal terminology that can actually make a person understand, oh, that's how it works. Because it could be scary. Like, is my personality going to change? What are the side effects of this?
Right. Okay. So, a psychiatric evaluation, I'll usually, not just cons physical things we want to know too, right? Age, weight, things like that.
Hmm.
Um, I really want to know about like what brought you to see me today? What are you struggling with? What's been happening in your life? And then also what has been your history? What has been, medical is super important, right? But also, what's your psych history been? Have you, struggled with anxiety a lot? Did you have a lot of anxiety when you were a little kid and maybe didn't notice that you were anxious because you've been anxious your whole life and now you're an adult and you're struggling with this anxiety or any history of substance use, things like that. So we do a very thorough just kind of history and, what your experience has been. And then I'll typically take a patient to go see the TMS machine just to kind of get an idea of like what it looks like, right?
Yeah.
It's
Is it huge and scary?
it's not. It's,
Okay.
but it looks techy. It's
Okay.
um but it's really, I guess the thing I would probably equate it to the most is it sort of looks like a dental chair, right? And then we have this,
Oh,
yeah, we have
okay.
the TMS machine and the paddles, which are typically not too terribly big.
Hmm.
Um, and we can actually turn the machine on and let you feel what the magnetic stimulation feels like, which is typically like a tapping feeling.
Oh, really? It's not like being electrocuted or anything like that?
No, no, not
Okay.
not so bad.
Okay.
It's a tapping feeling. Actually, some
Mhm.
people, while they're getting their treatment, will actually just fall asleep. It's not, and
Wow.
there's no sedation. You come in, do your TMS treatment, which can range from just a few minutes up to like, maybe it can take 20 to 30 minutes.
Okay.
And then you're done for the day. You can go about your day. There's no sedation involved, nothing like that.
Mhm.
As far as side effects go, I haven't seen too much because typically, the most common side effect would be a headache or discomfort at the stimulation site.
Mhm.
And they're transient, the pain will stop when you take the stimulation away. Um, and then, if you get a headache from the treatment, then over-the-counter medication and typically resolves, quickly end of the day,
Yeah.
not anything terrible. And then we'll reduce the stimulation that you're getting, and hopefully you won't have that side effect again.
Okay. I'm wondering how many do you need, or is it like if, say you have a client who at 13 years old started antidepressants,
Right.
okay, 13, and now she's 23, so it's 10 years on antidepressants,
Hmm.
and she's still depressed.
Hmm.
How do you utilize the TMS with those kinds of clients that or patients that have been, really trying to, and and they've been on or antipsychotics or anti-anxiety medicine or, benzo or so many different medications, and now they're like, okay, now they're going to try something different because they're not feeling right still.
Right. Yeah, it's It can absolutely be used as a adjunct treatment.
Mhm.
Um, Actually, it was FDA approved for adolescent depression, 15 and up,
Really?
um, fairly recently.
So there's no black box warning?
No black box warning. No, as a matter of fact, I've seen it be very helpful for people who have kind of chronic suicidal ideation, or,
Yeah.
where it comes up a lot. That's, in the more persistent and severe depression, I've seen a very significant, noticeable improvement, which has been really
Wow.
amazing.
No wonder you like are so excited about, I mean, like that's the
Yeah.
thing. Because
Yeah.
that's I guess because I work with a lot of clients that come to me after they've been into the system for a while, or they've never been to therapy at all, and they think, they come to me and it's the first time ever. And so this is why I work with psychiatric nurses and psychiatrists and other MDs, functional integrative doctors or nutritionists or stuff like that, because it is having that holistic approach to understand that the human being, right, is like they're unique. They're a thumbprint.
Right.
But at the same time, you study brains and then you understand the science. It's like trying to have the person in front of you like have some agency and control too, without just giving it all up. And that's the hard part with adolescents. They don't have a lot of choices really.
Right.
And so with TMS, I'm still like, you know, how many sessions does it take before are people receiving results right away, or does it like go after the 3 or 4, I mean, I know it's going to vary depending on what the person is carrying.
Right. It depends. So, and it would also depend on, the protocol you're doing. So there's typically they're more inpatient type facilities where you'll
Okay.
do multiple TMS sessions in a single day, and then you'll
Really?
see results much more quickly.
In one day you could do more than
You
one?
can. Yes. It's recommended that you take, a 45-minute or 50-minute break in between treatments to
Mhm.
allow for, kind of neuroplasticity to take place.
Oh,
Um,
let's stop there for
yeah.
those that don't know what neuroplasticity is, because some people remember, like I'm talking to people, well, I'm talking to whoever listens, but I'm talking to people that hopefully that are learning in this show. So neuroplasticity, for those that don't know what that is, because that's a word that we use, that's like,
Right.
but someone that's like going, what is that? That sounds, I'm like, what? I know it's
Yeah.
like the plastic brain, but do you want to explain a little what neuroplasticity? Let's
Sure.
talk about that for a
It's
minute.
the ability for your brain to form new connections and, forge new pathways and kind of develop new ways of functioning.
Yeah.
Yeah.
Yeah. So it's basically understanding that your brain can learn and rewire itself. And it's amazing the science behind that, to a place where a lot of people don't understand that, Jackie. I'm serious. They don't think that, because remember back in the day, back in the late 1900s, they taught us like, here's your brains on drugs. Any questions? Like you weren't able to rewire anything. Back in the day, they thought we only had a certain amount of cells and that was it, or neurons, and that
Mm,
was it. And they were thinking that's it. And I know because of my son, the youngest son that I was telling you about, had a brain injury. That's when I went into the deep dive of neuroplasticity in 2012.
yeah.
And that's when I started learning. I'm like, wait, what? Huh? Oh, I can do this. I could try that. And there was some weird movie that showed people. I don't know if you ever got to see it, but
Oh.
it's oh my gosh. I'm gonna see if I can find it, guys, and put it in the show notes.
Yeah,
But
yeah.
it showed like the guy who couldn't use, he had a stroke and couldn't use, but they put a mirror and the mirror image, so then he was able to. It was
Oh,
so,
cool.
and they studied the brain. So back with TMS, is there any myths you wish people would stop believing about it?
Um, I guess, something that I can see would be something that people might be concerned about is that it's something a little bit more intense, like something more like ECT, right? Which is the induction of a seizure while you're under anesthesia, which does amazing things for people. And for some people, they've tried everything else and it's all that works for them and it can do amazing things. Um, but it does have more side effects than something like TMS does, and it is more, again, it requires that you be sedated. Um, and I feel like there could be a little fear, especially with that, the movie of One Flew Over the Cuckoo's Nest, or it looks scary, but TMS, I mean, we talked about the side effect of a headache. There's also the possibility if you have a seizure disorder that it can induce a seizure. So that's definitely something you'd want to talk about with your provider.
Hmm.
Also, if you have the propensity towards bipolar disorder or psychosis, that would be another thing that you'd want to discuss with your provider because we are stimulating brain activity typically, depending on the
Hmm.
protocol, and that stimulation can sometimes go a little bit overboard in people who are sensitive to, experiencing those things.
Right.
So that would be another thing we'd want to kind of keep a lookout for. But you typically will, so let's say you do a typical depression protocol, that's typically around 36 sessions. So you'd want to go, 5 days a week for
Wow.
36 sessions. There's some variability there, but, and then typically we start to see improvement in depressive symptoms within the first few weeks. It takes a little bit of time
Hmm.
to kind of get the depression symptoms to start to improve. But once we see that improvement, I've noticed that it's pretty significant improvement. And typically, even after completing your 36 sessions, there'll be a period of, I mean, we hope remission, right?
Yeah.
Long lasting
That's what
remission,
I was going to ask. It's like, how long would it last? Or is it something you have to do continually forever now, kind of like having to take the
like medication.
prescription or medication or
Yeah.
something like that? Is it something you have to do? Do you combine lifestyle change too, or how's that work? Do you have a conversation on those things too, or no?
Definitely, part of the psychiatric evaluation, we talk about lifestyle. What's your diet like? How are you sleeping? Are you getting any exercise? What are are you in a really stressful job? Are you in a really toxic relationship? Like what other factors are contributing to like how you're feeling?
Hmm.
And TMS will work. I mean, it stimulates blood flow to the area of the brain that we're targeting. It, causes the release of neurotransmitters in that area and decreases inflammation. So it will definitely have an effect. But like anything else, if you're not also kind of working on
The
the
other things,
day-to-day things,
right?
then there's only, so much it can do and so long it will last, right?
Right. Yeah, because yeah,
Yeah.
because then it's like neuroplasticity, right? You're rewiring the brain, but if you go back to old patterns, it's going to start rewiring that way again,
Right.
right?
Right. It can do that. Yes.
I want to know how does it, well, first of all, here's my thing. Can you take it and like put it in different parts of your body to stimulate and make it better there, or just the brain?
That I'm not sure. I imagine there could be some similar device that would
Mhm.
work that way. Um, but not that I'm aware of. Yeah.
Yeah, I wonder if they're studying that, if the companies are studying that, and it's going to
It
come
wouldn't
out later,
surprise me. Who knows?
right? Yeah. So, how does it actually work? So it's stimulating the brain, but is it like what is it? Like electric or how does it
So
work?
yes, electric.
Uh-huh.
Electrical activity between neurons. It's stimulating the depolarization of neurons so that they are releasing neurotransmitters, communicating with each other. The stimulation itself is affects very surface areas of the brain.
Okay.
It doesn't it's not penetrating that deeply, although there are certain coils that will penetrate more deeply than others. But even just when you're stimulating these more superficial areas,
Mm-hmm.
they communicate downstream with deeper brain areas. And then if we're increasing blood flow, we're increasing oxygenation. and, decreasing inflammation. I mean,
That's a big deal. Like inflammation, I've learned
yeah,
it throughout the whole body. That causes so many different things in people, and people don't even understand what that actually means. What do you mean inflammation? And I'm just like, well, there's certain foods you eat that can inflame your brain. There are certain things in your gut that can inflame your brain, or just the
chronic stress. Yeah.
stress. That's
Yeah.
like one of the number one things in people. But we live in this society we run on chronic stress.
Right.
And it becomes it comes to a place where running on that chronic stress is like a badge of honor.
Yeah. It's maybe not the healthiest, way to
Yeah,
function, right?
right. And it
There's something to be said for getting a lot done and being really productive, but also our bodies need rest.
Yes,
Yeah.
right. And that's why I think collaboration is so important. This is why, like, I invite people like you on to collaborate because, yeah, somebody can hire me to help them in a certain area, but then they can hire you to help them in that, move them forward in a different area of what they need, or someone else, like a holistic provider. We all work together for a reason. Like we're in this. Well, I know I'm not in it for money because that's just not, I'm in it because I'm trying to break stigma and have people understand, especially in the faith community and in the Black and Brown community. Because, it's hard because sometimes I know I was raised not to trust many systems.
Hmm.
Right. And I'm glad kind of now that I'm looking back, I'm like, thank you.
Oh, whoa. Yeah.
Thank you. But I also have a big respect for new scientific creations or modalities because this is moving forward. We have evolved. I really think it's just the intention of the heart of the provider. Because I mean, I can tell when a provider is just about seeing humans as a number and that's it, right? And that's why I try to get people to understand as they listen, hopefully to all, by the time this comes out, like all 99 episodes, that
Mhm.
they'll understand that no, like you have rights,
Yeah.
informed consent, and not all of us in these fields are corrupted by big pharma or the insurance company, because that's a hard thing for us, Jackie, like honestly, because sometimes when I'm like, I'm a therapist, a licensed therapist, some people will come across and be like, oh, so you're this or you're that, all these assumptions and all these myths about certain things. Like, how do you handle that, when if because I've heard it. I know that sometimes I get angry at the psychiatric parts of our system. I do.
Hmm.
Just because I
Hmm.
worked in alternative high schools for so long and I saw some of
Hmm.
the damage. What's different about you?
Well, um, I hear what you're saying about the system and how it can be corrupt and things like that. Um, and I've heard stories about that, but most of the healthcare providers that I've experienced and worked with, including myself, we really do want to help. We may be limited by the insurance industry, right? We may not be able to suggest certain things or utilize certain things because we're kind of pigeonholed into using these other things that are approved by insurance. But I'd say what kind of separates, a really great provider is someone who really cares. They really listen to you. Again, they need to have enough time to listen to you, but right.
Right.
They listen to you. They're willing to kind of work with you if you don't want to try something for whatever reason, you can explain your reason. They can go ahead and tell you, maybe if you have this concern and there's evidence that the provider can explain to you that maybe that concern is really like not very common or whatever it might be, that might make you feel more comfortable. And then you're like, okay, like now I feel better about it. But if you still don't want to try it, then absolutely. There's so many options out there
Yes.
now that it's, important to try to find a provider who can work with you on what you're willing to try. Because, we talked about teenagers. We don't want to force them into doing something that they don't want to do, especially, if they're going to have a side effect that they don't like.
Right.
this is, the patient's life, and we're here to just help them have a better life.
Right, to provide a service. And I think it's to make the human understand that they have rights and that we respect them because that's
Yeah.
something I saw back in the day. I mean, things have changed and shifted a lot since I was working, at the alternative high school, and they're going to keep changing. And so this is why I thought it was important for someone to listen about TMS and exploring that. Like,
Yeah.
when should they consider meeting with a nurse practitioner like you and exploring the options like TMS? Like if someone like, when, because if they're feeling stuck for years, who do they talk to? Is there like a specialized website or something, or like how can someone learn more about this? Do you know of anything?
About finding a provider or,
Well, TMS. Just if
oh,
someone's now curious about that, is there a book or a resource that I put in the show notes that can, maybe they could see the paddles or they could see it happening to someone, like, because that's a scary, you're right, that is a
yeah,
scary thing. I know, like, when I first went into EMDR, I'm like, oh my gosh, they're going to hypnotize me and put thoughts and I'm going to start clucking like a chicken. No, I'm just kidding. I wasn't. But you know what I mean? Like, is there anything that you know of that can help, like a patient or someone that's like curious about it?
so the TMS device, so the company that I've worked with that makes the machine that I've used is
Mhm.
MagVenture, and
Okay.
they have videos you can watch and a website that will teach you more about and show you some things about TMS.
Hmm.
There's also, IMMH has some papers about TMS and usefulness and improvement. Um, as far as
Okay.
book goes, I haven't seen a book yet, but I'm sure there is one.
No, that's okay. That's perfect. I
Yeah.
could I could put those two in the show notes and stuff like that. Well, what about exploring? Because how would you bring this up to, say, a psychiatrist? If like, or wait, can just medical because I know that's one thing too. That's a whole nother hour to talk about where you have like regular general practitioners giving out medication like crazy, psychiatric medication, and I swear causing some harm. That not all of them, but they did not study like you did,
Right.
right? They didn't study like I did the behavioral and the psychology behind of a human being, right? So then when you have these pediatricians or general practitioners that are just saying, okay, you have anxiety, and I'm like, wait a minute, did you do an ACE score? Did you spend some quality time understanding their trauma background? Did you, I could keep going on with the list, and in 15 minutes, they're now on benzos and addicted.
Right.
You see what I'm saying? So what do you say? Like, um, to a person listening right now going, oh, I didn't even think about that. Like how TMS, like how do you ask about that? Do you just say, hey, I'm curious about TMS, or what are you looking for?
So, if you've been struggling with mental health, depending on what you're going through, right? A therapist can be a great first stopping place to just kind of talk about what's been going on.
Hmm.
I encourage pretty much all of my patients to work with a therapist while we're doing TMS or adjusting medications. Um, but you could also, if you're working with a primary care provider and you have been struggling with mental health issues, you can let them know. And I would meet with a specialist. I would recommend that definitely, just because they know more about the different resources that are available.
Okay.
And then, maybe your PCP can refer you to either a psychiatrist or a psychiatric mental health nurse practitioner, or they also have PAs that specialize in psychiatry. And then they can talk to you more about, your different options, um, and if TMS is something you're interested in, if you'd be a good candidate for it or not, or if there might be something
So
different. Yeah.
so it's very thorough then. It's not just like, oh, hop on the bed or hop on the chair and let's
I'm
start. Like,
sure if you contacted like a place where all they do is TMS and you called them first, that
mhm.
maybe it would be a little bit more of a quick
Okay.
quick transition to do that. But
Right.
they would still have to do a thorough assessment. But that's why I would kind of touch base with, someone who specializes in the psychiatric field, just so you can kind of talk about your different options and let them know before schedule maybe your psychiatric evaluation that that's something you're interested in and see if they have any experience or would be potentially willing to refer you out for that. If not,
Right. Yeah.
just to make sure that they would be kind of the right fit for you and know about the things that you're interested in doing.
How long have you been practicing TMS?
So let's see. I've been doing it for about a year now.
Okay. So you
Yeah.
had to have a special training in it then.
So I did training. There are
Yeah.
there are trainings that you can go to, absolutely. That's more so for clinicians than
Hmm.
patients, but
Okay.
yep, there's special training. I also collaborate with different psychiatrists who
Hmm.
will, in the state of Florida, I enjoy collaborating with them, but also I
Yeah.
have to, right?
Yeah. Yeah. Exactly.
We talk about different protocols and things like that that can be done, and if this patient's appropriate or not appropriate.
Okay, good. So if somebody is wanting to work with you and they want to come to you because they now notice how kind and gentle and how caring you are, how do they work with you?
So I have a private practice called Rising Tide Psychiatry. And it's a telehealth practice. I'm licensed in the state of Florida and the state of New York. So I can work with patients in those states. And you can just call me. I just give people my number. They can call me, tell me about what they're experiencing, and we can determine if I'm the right person for them or if I can help them find someone who would be a better fit for them.
Okay.
Yeah. Or
So,
I have a Tebra page, which is my EMR, where you can, just look me up. It's a long
yeah.
address, but
And I'll put it in the show notes for sure.
okay.
Yes. And so if they're working with or they're trying to reach out to you, do you take insurance?
I don't take insurance, just
Okay.
kind of partially because of those limitations that it kind
I
of
don't take insurance
imposes.
either. So
Yeah.
I get it. I get it. And it's
So,
just, people get frustrated, but at the same time, like when they realize you have a little more freedom to be able to do not genuine, but how would we say it? Very, we spend more time. We are able to spend more time and give you quality therapeutic services. That's how I explain it. So, okay, but how would you do TMS? You send the person to a TMS center or
so I
something?
also, so y- there's different TMS centers in the South Florida area. But I also I work part-time at Rico in
Oh,
Delray, and
okay.
they have TMS there.
I just got an email from them today inviting me to
Oh,
come take a tour.
what are the odds?
Uh,
Yeah.
that wasn't you, was it? No, it
No,
was some guy.
it wasn't me.
Whoa. Doo-doo-doo-doo-doo-doo-doo. That's
Yeah, so you
awesome.
can, go check out the facility
Yeah,
and
I'm going to.
yeah.
Now that I've had a conversation with you, I'm going to now RSVP.
Yeah.
That's cool.
And the program there is a PHP and IOP mental health program, but you can still participate in TMS as an outpatient there.
Oh, okay. And so that's how they can work with you there,
Yep, we can
right?
work together there.
Okay. Do you have a place in New York too, or just in Florida?
As far as TMS
Mm-hmm.
referrals go, just in Florida at this point.
Okay. All right. No, that's good to know. That's good to know. So sh you work in, do you deprescribe? Do you help
I
deprescribe?
deprescribe, I do micro tapers, I utilize supplements, all the kind of things
Good.
that I get to do now that
Yeah.
yeah, that
Oh,
I
good. Do you know Dr. Fuhrer?
I do.
Oh, good. Because to me, I'm
Yes.
just like, you two could be a system together because this is why I'm so excited because I meet when I'm networking and then I meet these humans that are understanding the holistic approach. I guess because I was so angry back in the early 2000s when I was learning and working with psychiatrists that I'm just like, oh, come
Yeah.
on. Human beings are more than just this medication thing. Like, and I'm not putting medication down. I'm not one of those either. That's like, no, I understand that the science, like it's like we need to see the human and see exactly what they need holistically, right?
Absolutely. Yep, there's
Right.
a time and a place,
Yeah,
right?
exactly.
Yeah.
So, all right. So just before we go and before we say goodbye, because I could keep talking to you for another hour, but I'm sure we both have clients after this. And so, if someone is wanting to improve their mental health or wanting to feel like themselves again, is there any kind of practical steps or tips or anything you want to say to a person right now that's listening?
Well, I would say there's some things you can do that are totally free and can be done today, right? So go outside. Go outside, walk outside for 20 minutes. Look around, listen to the sounds of the wind and the leaves and, the water. We live in a beautiful area where we get to look out at the vast ocean. I mean, that's
Yeah.
healing.
Yes.
Um,
Or,
so
or, or
that
any nature space, because for those that are outside of the country or outside of the state of Florida,
Any
just
nature, well,
right.
absolutely. I mean, there's been more and more talk about forest bathing now, where
Hmm.
you're amongst the trees. Absolutely. And just walking. I mean, even if you're not outside, just walking around, the bilateral movement that's been shown to help people process things, blood flow again, inflammation again, right?
Yeah.
Um, Social media. The more we use social media, it kind of like can be harmful to our mental health and well-being sometimes a lot, especially if we're comparing ourselves to other people or um, reading things that make us feel bad about ourselves, whatever it is, or stress us out.
Hmm.
So maybe limit your exposure to that or
Yes.
and also, spend time with someone you love, whether that be someone in your family or a friend or an animal, just another being present with, I would say. Like those are all, or plan something that you can look forward to, right?
Yeah, Eventbrite meetup. I mean, that's here. Like, that's something that I encourage my clients to do is to sometimes I'm like, you need to go volunteer, but I'm so depressed I can't get out of bed. I'm like, then you need to go volunteer. And they're like, and they're like, that doesn't make sense. But then when we figure something out that they love, it reconnects. It makes them realize that they have a purpose because each one of us have a purpose. I don't care
Right.
where you are. Each one of
Yeah.
us have a purpose. Wow, Jackie. So it was such a pleasure to have this conversation with you. Thank you so much to educate me on TMS and I'm going to I'm going to go watch some videos now on TMS
Okay, yeah.
and I'll
Absolutely.
put the mag you said mag venture, correct?
Ag Venture. Yep.
Mag
There are
venture.
different machines.
Hmm.
Also,
Okay.
Neurostar is one, BrainSway is one. So there's
Okay, yeah. I just want to understand it more. And just because we recommend things doesn't mean you guys go out and do it. Go to a medical professional. This is just educational information only.
yeah.
All right, Jackie, thank you so much. And listener, please, please do not forget to trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor Podcast, guests appearing on the podcast at the invitation of the Holistic Counselor Podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor Podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.